we decided to do a video over the muscles of the body and their origin and insertions. This is the buccinator, be right here. It compresses the cheek. Its origin is the molar region of the maxilla and mandible. It's going to be right here. And its insertion is orbicularis oris. It's going to be right here. The epicranius frontalis is going to be right here. It raises the eyebrows and wrinkles the forehead. Its origin is the occipital and temporal bones. So the occipital bone is going to be in the back, and then and the temporal bone, temporal bone is going to be right here. Its insertion is the skin of eyebrows and the root of the nose. So skin of eyebrows and the root of the nose. The epicranius occipitalis is going to be in the back. It's going to be right here. It raises the eyebrows, wrinkles the forehead, also does the same thing as the epicranius frontalis. Its origin is the occipital bone, which is back here, and the temporal bone, which is over here on each side. And the insertion is the skin of the eyebrows, so right here, and the root of the nose. Orbicularis oculi is going to be right here, this muscle that goes around the eye. It closes the eye tightly, but it's not involved in blinking, so just whenever you squeeze your eyes shut. Orbicularis oris is going to be right here around the mouth. It closes and protrudes the lips, so when you pucker your lips, your orbicularis oris, that's the muscle that's doing it. Your zygomaticus major and minor is going to be right here. This muscle that goes diagonal across your cheek. It raises the corners of the mouth, as in smiling. Its origin is the zygomatic bone, which is right here. And its insertion is the skin or muscle at the corner of the mouth, so right here. The masseter is going to be right here. It closes the jaw and it brings up the mandible, so it lifts the mandible. Its origin is the zygomatic arch and the maxilla, and its insertion is the angle and ramus of the mandible. So the angle and ramus of the mandible is right here. This curve and then this straight part. The temporalis is right here. Can you see that? Temporalis is this muscle right here. It elevates the mandible and closes the jaw. Also, it does the same thing as the masseter. The sternocleidomastoid is right here. You have one on this side, and it's not pictured, but you also have one on the other side too. With one side contracting, it turns the head to the opposite side. So if this side contracts, it's going to turn the head that way, and if this side contracts, it turns the head this way. With both sides contracting, it flexes the head and pulls it down to the chest, and it raises the sternum. The origin is the manubrium of the sternum, so it's going to be right here. And the insertion is the mastoid process of the temporal bone. The biceps brachia. Okay, well, it's not on this model. It's not, we didn't have a chunk. Right. But it would be right here. See where this ligament connects to this ligament right here. It flexes the forearm at the elbow. Its origin is a coracoid process and shoulder joint right here. And its insertion is the mastoid process of the temporal bone. Wait, I'm sorry. Its insertion is a radial tuberosity. The brachialis is going to be underneath the biceps brachia, so this muscle right here from this side to this side. It flexes the forearm at the elbow also. It does the same thing as the biceps brachia. The deltoid is going to be this muscle right here. It abducts the humerus, so it pulls the humerus away. It flexes or extends the humerus, and it's also a site for injection. So whenever you get a shot, they most of the time do it in your deltoid right here. Its origin is the acromion and spinous scapula. It's going to be right here and in the back. And its insertion is a deltoid tuberosity of the humerus. Extensors are going to be several muscles on the dorsal surface of the forearm, which extend either the wrist or the fingers, so they're going to be on this side of the arm. And flexors are several muscles on the anterior surface of the forearm, which flex either the wrist or the fingers. So flexors are going to be on this side. Infraspinatus is going to be on the back. The infraspinatus is going to be right here, this muscle. It laterally rotates the humerus. The latissimus dorsi, or dorsi, is right here. It's right here, sorry. This muscle right here. No. Just kidding. That's your trapezius. This is your latissimus dorsi. It's going to be this muscle right here that goes up and it goes all the way down right here. That's going to be its ligament. It extends and adducts the humerus, pulls shoulder down and back. The origin is the lumbar vertebrae, the last 3 to 4 ribs down here, the iliac and the iliac crest. It's going to be right here on the other side. Its insertion is the floor of the intertubercular sulcus of the humerus. The levator scapulae is going to be this little muscle right here in the neck. It's going to be about the sternocleidomastoid, right beside it. It just elevates the scapula, so it pulls the scapula upward. Its origin is a transverse process of vertebrae C1 through C4, and its insertion is the medial border of the scapula. The pectoralis major is this right here. This muscle will be right across the chest. It pulls the arm forward and across the chest. It adducts and medially rotates the humerus. Its origin is the clavicle, right here. The clavicle, the sternum, cartilage of ribs 1 through 6, intertubercular sulcus of the humerus is the insertion. Pectoralis minor, it's going to be, you can't see it on here. It's going to pull the scapula. It's going to pull the scapula forward and downward. It's going to raise the ribs. The rhomboidus major, it's going to be in the back. Rhomboidus major is right here. It raises and adducts the scapula. The serratus anterior will be on the front. Serratus anterior is going to be right here on the side. These little muscles right here. They pull the scapula anteriorly and downward. Teres major. Teres major is going to be this little one right here. It extends, adducts, and medially rotates the humerus. The teres minor is going to be right. Can't see it. I think it's this one right here. This little muscle right here. It laterally rotates the humerus. The trapezius is going to be this muscle, this big muscle right here. It's going to go down this way, down, and it connects up here. It has several movements of the scapula: rotation, elevation, and depression. Its origin is the occipital bone, the spines of C7, all thoracic vertebrae, and its insertion is the acromion spinous process of the scapula. The triceps brachia are going to be on the bottom of the arm. It extends the forearm. Its origin is the inferior margin of the glenoid cavity and posterior humerus, and the insertion is the cranial process of the ulna. Gastrocnemius is going to be right here. It's going to be basically the backside of your calf. It plantar flexes the foot and flexes the leg at the knee. Its origin is the medial and lateral condyles of the femur, and its insertion is a calcaneus via calcaneus tendon, which is going to be the calcaneus tendons right there. Gluteus maximus, either side, right here. It extends the thigh at the hip. Its origin is the dorsal ilium, sacrum, and coxal. The insertion is the gluteal tuberosity of femur and iliotibial tract. The hamstrings are going to be these on the back. They flex the leg, extend the thigh. Their origin is the ischial tuberosity, linea aspera, and distal femur. Their insertions are the head of the fibula, lateral condyle of tibia. The rectus femoris are going to be these down here, right here. The rectus femoris, vastus lateralis. Rectus femoris, vastus lateralis is underneath, and vastus medius and vastus intermedius are on this side. They extend the leg at the knee. They're also the quadriceps femoris. The sartorius is going to be this is the biggest muscle in the body. It's going to go, it crosses the leg Taylor or Indian style. The tensor fasciolatae, it's going to be this little bitty muscle over here. It abducts the thigh. Tibialis anterior, it's going to be right here. Dorsiflexion of the foot. The external oblique, it's going to be right here. It's going to be on this, the very side over here. It tenses the abdominal wall, compresses the abdominal contents. The internal oblique are going to be right here. They do the same. They tense the abdominal wall, compress the abdominal contents. The erectus abdominis is going to be right here. It does the same thing. It tenses the abdominal wall, compresses the abdominal contents, but it also flexes the torso at the waist, as in sit-ups. Its origin is a pubic crest and symphysis, be down here. And its insertion is a xiphoid process and costal cartilages of ribs 5 through 7. The transverse abdominis is going to be inside, it's going to be on the side. You can't see it, but it tenses the abdominal wall, compresses the abdominal contents.